Good afternoon. Thank you for joining us for today's webinar on the costs and savings of person-centered guardianship. I'm Kimberly George, President and CEO of Project Guardianship. Our team conducted a cost-benefit analysis using 10 years of client data from our guardianship services program, and we're excited to be able to tell you about the results today. A couple of housekeeping items before we get into the details. First, we are recording today's webinar and will email the slides and the full report to everyone afterwards. Also, please use the Q&A feature to ask questions at any point during the webinar. We will answer as many questions as time allows at the end. And now, before we get into the content, we're going to start out by finding out who's in the room with a quick poll. Okay, great. It looks like we're mostly nonprofit professionals in the room with government a close second. And then we have a few people from the private sector, philanthropy, academia, and hospitals, and then some in the other category. Great. Thank you all for answering our poll. I'm just waiting for the slides to come back up. Great, here we are. Um, First, I just, want to go over our outline for today, which is I'm going to share Project Guardianship's mission and our approach to achieving that mission. And then my colleagues are going to talk about our guardianship model, the cost benefit analysis. We'll share a client story that highlights where the costs and the savings are coming from. And then we'll talk about what these findings mean in terms of the guardianship field. So Project Guardianship's mission is to provide person-centered care for older adults and individuals living with disabilities and mental illness who need help making decisions. We also transform the systems and services that support them to promote independence, preserve dignity, and advance racial and social justice. Our approach to achieving this mission falls into three categories. The first one being our guardianship services. PG has been providing comprehensive guardianship services for low-income New Yorkers who are aging alone for over 20 years. My colleague is going to talk more about our guardianship services because the results of our cost-benefit analysis are specific to our multidisciplinary team model with low client to staff ratios. The second pillar of our work is guardianship alternatives. For Project Guardianship, it is of utmost importance that guardianship be the true tool of last resort and that all less restrictive alternatives be exhausted. We therefore operate a guardianship prevention and support helpline that anybody can call if they're calling about somebody living in New York, and they can get an attorney live on the phone within 26 to 36 hours, if not immediately. We also have two pre-pilot projects to explore new options to avoid or delay guardianship. One is developing a supported decision-making for older adults model, distinct from, but learning from tested models of supported decision-making for people living with intellectual and developmental disabilities. The other is an agency power of attorney model for people living alone with no individual to be their power of attorney and healthcare proxy. And then the third pillar of our work is guardianship reform. Project Guardianship provides research and recommendations for improving guardianship in New York State. In 2015, we conducted a cost-benefit analysis of our services. Today's study report provides a more robust update to that analysis. In 2018, with support from the New York Community Trust, we conducted a study of New York's guardianship landscape, and in 2019, released a report with 30 recommendations for improvement. That report became the basis of an application with the New York State Unified Court System to the Administration for Community Living to one, conduct a needs assessment, which engaged nearly 1,000 stakeholders in New York's guardianship system. Two, to enhance New York courts' data collection on guardianship. Three, to create new resources on guardianship and guardianship alternatives and prevention, including a new website, videos, guides, and a series of webinars that are currently taking place. And fourth, to develop uniform guardianship forms. And in addition, we're currently advocating for New York State to create a publicly funded statewide coalition of nonprofit guardianship, as well as working towards other advocacy priorities and policy changes. Now, I'd like to hand it off to our Chief Program Officer, Nicole Negron, to tell you more about our guardianship services model.
Thanks, Kimberly. Good afternoon, everyone. As Kimberly said, I'm Nicole Negron. I'm the Chief Program Officer for PG's Guardianship Services Program. We are a nonprofit agency guardianship program with a unique model, so I will take you through what that looks like. Our guardianship services program is comprehensive and person-centered, meaning that we consider each individual and we make decisions that consider the individual's identity, history, preferences, and we're providing personalized care to each individual. Part of this is also maximizing autonomy, involving clients in decisions about their care whenever possible. And this will vary by client, and it does take more time and effort than just unilaterally making decisions and sort of having one way to do things. But in the end, providing this level of personalized care is how we're able to best serve our guardianship clients. And it's in keeping with the goals of New York's guardianship law, Article 81, tailoring our care to the individual and being as least restrictive as possible while protecting and caring for the clients. So how do we do that? Each guardianship services client has a multidisciplinary team, which consists of a case manager, an attorney, and a finance associate. And then we also have a benefits specialist and a housing specialist who work with all of the teams. The teams meet regularly to discuss every client on their caseload. So as you can see on the slide, the diagram is showing who the team members are. So each PG client has someone in each of these positions assigned to their case. A quick description of what each of those team members does. The case manager is the one regularly monitoring the client's condition. They're making monthly in-person visits, communicating with the client throughout the month as needed. They're also monitoring the client's living conditions, the services that are in place, or services that are needed. The case manager is coordinating the care for the clients, and they're communicating with service providers, medical teams, family members, and so on. Then you have the team attorney who works in sync with the case manager, ensuring that we're acting in accordance with the order appointing us as guardian, in accordance with our legal authority on that particular case. And they're providing legal counsel, advocacy. The attorney handles all compliance and court-related matters in the guardianship court, as well as any other legal issues on a given case. So like there's often housing court eviction issues, or sometimes they'll be drafting trust documents for Medicaid planning, anything that requires legal expertise, or even doesn't necessarily require legal expertise, but maybe can be aided in pushing things along by having a lawyer on top of it. Then third, we have the finance associate. They manage the client's funds, so they'll handle marshaling bank accounts and income, managing the client's budgets, paying the bills, approving expenses, filing taxes. They prepare all the accountings for our for compliance requirements. Everything financial goes through this person. Then we also have the housing and benefits specialists that serve all of our clients. The benefits coordinator handles all applications and recertifications for all client benefits. So, Social Security, Medicaid, SNAP, um, one-shot deals from HRA, accessoride, free cell phones, any benefits that a client may be entitled to or could benefit from. We have our benefits expert facilitating those. Similarly, the housing specialist submits all housing related applications. So everything from NYCHA, Section 8, supportive housing, just setting up apartment viewings for clients. She also handles all physical work to do with housing. So if we need to set up a cleaning or a locksmith or exterminations, repairs, these are things that go through the housing specialist. And we have those experts supporting all of the teams. So these are the people who we have working on every single client's care. We have high staff to client ratios. We have one case manager for every 25 clients. So each team has one case manager with a maximum of 25 clients on it. And then each attorney is assigned to 2 teams. So it's one attorney per up to 50 clients. Same for finance associates, it's also 1 to 50. Overall, with the different types of staff combined, we have a 1 to 10 staff to client ratio. In our guardianship program, we make every effort to keep people in their homes and out of institutions, as well as moving people back home from institutions when possible. Too often people get stuck in nursing homes after an injury or an illness because there's just no one to make the arrangements to get them home. Hospitals are supposed to ensure a safe discharge plan, but they don't have the power to effectuate safe conditions or services outside of the hospital that would give a patient somewhere safe to return to. So, for example, if the home conditions are unsafe due to excessive clutter or need for repairs, if the apartment isn't accessible based on the patient's limitations, or if there's no one in place to provide assistance at home, there's no home care services. These are all things that as a guardian, we're typically authorized to handle and we're very capable of handling. So in that way, we're able to bring people home so they can continue living in the community with the necessary supports. We also have expertise in making end-of-life decisions in accordance with the law and in accordance with the client's wishes. We often put in place measures that increase our clients' comfort, prevent painful or excessive interventions. We try to ascertain clients' wishes as far as life-sustaining measures and plans for the end of their lives early on when they become clients, and in hopes of documenting and being able to consider those preferences down the line if and when it becomes necessary. No money, no problem. This means we serve as guardian to clients regardless of their ability to pay. We're providing the same high level of service for our clients regardless of their income or assets. And we have the capacity to provide services for the court's most complex cases. Thanks to this multidisciplinary team model, we're able to draw from several areas of expertise and collaborate to develop a plan for these cases. We are also willing to serve as co-guardian of personal needs with a person's family or friends. Sometimes there is someone around who is involved and wants to help, but they may not be able to navigate complicated issues themselves, so they might not be able to serve as guardian alone without extra support. So in some instances, we may be appointed as co-guardian with the family member or friend, and we are able to fill in the gaps in knowledge or use our expertise to navigate those complicated issues. So that is the general overview of Project Guardian's model, and hopefully it gives some helpful context and fills in the picture for you a bit as we move on to the cost-benefit analysis. And for that, I will pass the mic over to Tahaya.
Good afternoon, everyone. I'm Tahaya. I am the Senior Manager of Data and Evaluation here at Project Guardianship. I'll be talking for the next 10 to 15 minutes or so about the cost-benefit analysis that Project Guardianship has been conducting for the last couple of years. So this analysis was actually originally conducted in 2015. It was a precursor report. And in 2024, Project Guardianship evaluated the financial and societal impact of its court-appointed guardianship services in a more robust fashion. So our starting hypothesis was that our services can support clients more comprehensively than hospitals, nursing homes, or fragile family structures, which would then lead to public dollars saved via stabilizing clients in the community and avoiding entry into nursing homes or other long-term care facilities before necessary. The process began with choosing which areas to focus on for evaluation. How we approach this is that we first use our intimate knowledge of client cases to map out high-cost services that our clients use. So you'll hear about nursing homes a lot, other facilities, high hospital utilization, all of that was targeted at first as high-cost services that our clients use. We then further looked at which of these services had direct connections to public dollars for this analysis specifically. We then further whittled that list down based on our data limitations. So what was possible for evaluation given the data available both from our own records and what was available publicly through the Department of Health or other partnerships that we made. So we came up with 5 areas for evaluation for the analysis. The first was reduced hospitalization. We hypothesized that there would be a reduced number of hospitalizations as well as a reduced length of stay once people had joined Project Guardianship's program as compared with before they joined the program. The second area was increased home care with the decreased nursing home care. So keeping our clients in the community would save money by preventing them from going into very expensive nursing homes and instead prioritizing getting them the home care that could have them stabilized in the community for longer. The third area was delayed spend down and Medicaid avoidance. So when our clients are over-resourced for Medicaid eligibility, we can then extend the amount of time that we use their personal assets to care for them until they're eligible for Medicaid. And so in that case, we are saving Medicaid money because we are delaying the time until they actually join Medicaid and then incur expenses in Medicaid. The fourth area is the recovery of Medicaid liens. So this happens when previously undiscovered assets or funds for a client are later discovered. This could happen after death. It could happen anytime during the guardianship. And so if we find these assets, we actually will pay Medicaid. And that also is a form of saving money by giving money back to Medicaid from assets that we were not previously privy to. And lastly, this last one is the only one that's not directly kind of health focused, and that is homelessness prevention and shelter avoidance. Project Guardianship operates in New York City, which has a very expensive homeless shelter system. And so if our clients come to us either housing unstable, at risk of homelessness or actually suffering from street homelessness, then stabilizing them in the community would allow us to save money for the shelter system by having them avoid that system altogether. Our data sources for each of these included hospital utilization records going back to, oh, sorry, you can stay on the previous slide. Our data sources include hospital utilization records going back to 2013. So our study period was from 2013 to 2022. So that's just under 10 years. And we also used internal client financial records and case notes for each of these. The internal records from Project Guardianship included case notes and financial records, and that gave us a picture of how our clients came to us at the time of petition. So we were able to assess their housing stability, whether they were at risk of homelessness or not, if they were already in a nursing home or within their own home or apartment in the community, things of that sort. We also were able to calculate the amount of Medicaid liens paid back to Medicaid directly through our financial records, and the number of days we were able to delay Medicaid enrollment. So that's for that delayed spend down, number 3. The hospital utilization data gave us the number of hospital visits and the length of stay for each of our clients, both before and after joining Project Guardianship. So I briefly mentioned the 2015 cost benefit analysis that was a precursor to the work that we're presenting here today. And one of the major ways we improved on that was to engage in more partnerships. And so I just wanted to point out some of the data sources and also researchers that helped us complete this report. So the first one listed here is the Bronx Regional Health Information Organization, also called the Bronx RIO. So the regional health information organizations, there are about 8 of them throughout New York State. And what they'll do is combine all of the encounter data they have for the hospitals and health centers that are within their system, so that if someone let's say in the Bronx is admitted to a hospital in Rochester, we would be able to know that information, so that all of these systems are talking to each other and we can better give care to people. And then for the case of guardianship, we can actually track where our clients are if they become missing, or if they have an emergency and perhaps are not able to give their name or are not able to say that they have a guardian. So this information exchange is incredibly important, and as guardians we were able to get our clients' hospital utilization records through this partnership. The second one here is George Mason University. We partnered with researchers that had expertise in medical billing as a data source, which is very complex. And so it was very useful to have their help on matching the actual dollar amount saved to Medicaid. We obviously had a lot of data on moving our clients in and out of hospitals or nursing homes or things of that sort. We had the data for their hospital utilization, but actually matching numbers to that information was complex, and experienced researchers in this exact field were very helpful. And the other thing is that we use natural language processing to analyze our case notes to look at some quality of life measures as well. These last 3 partners here are informal partners because what we did was use publicly available data whenever possible to match those dollar amounts to other things such as the homeless shelters. So we have the New York Department of Health and Mental Hygiene, Coalition from the Homeless, and the Kaiser Family Foundation. So through various reports and publicly available data, we were also able to assign costs to the model that we were evaluating. So the methodology, here we have this diagram here just shows the sampling method that we used. So as I said before, our study period was from 2013 to 2022, just under 10 years. And what we did was we took clients who had entered PG over that 9.5-year period, and we sent that entire roster to the Bronx RIO in order to match them in the health exchange system. About 86 clients came back with a match at all. And then from that number, 33 clients had information both before and after joining PG. This was especially important because we wanted to be able to conduct a pre-post analysis. As I said, we want to compare the length and amount of hospital stays from before as well as after joining PG to see if there was a difference and what that difference was. So those 33 clients were used for the hospitalization analysis. And that sample is only for the hospitalization analysis. And then we widened that to 86 clients, our sample, for everything else. So for homeless shelter avoidance, nursing home avoidance, psychiatric stay avoidance, all of that, that sample, it will be 86. So in the report, you will see that we're reporting on 2 different samples, and they'll be clearly labeled, but just know that that's why. So we have 2 different samples here. And the end date for our study, it was either one of these 3 options. So it was death during the time of guardianship between 2013 and 2022. If the client lived throughout this entire period and past July 1st, 2022, then the end date for their study enrollment was either the date of guardianship termination for any cause other than death. Maybe that was a successor guardian, or their rights were restored, or any number of things. Or for everyone else who is still currently a client with us, the end date was set for July 1st, 2023, which is 1 year after the end date of the hospitalization data that we collected. So before we get into the actual statistics of the findings, I also want to mention that we use the statewide planning and research cooperative system, SPARKS, to use patient level and payer information data in order to assign those values to the hospital stays. So in case you're interested, it's SPARKS, SPARCS. So what did we find? We found that majority of the clients had reduced hospital stays after Project Guardianship had become Guardian. So as you can see here, 79% of clients had a reduction in hospital stays. We saved over 16,000 hospital days. And 3 out of 4 clients had a reduction in psychiatric hospitalizations. 42% of clients were at risk of homelessness, but were either kept out of or taken out of shelters and then stabilized in the community. While these statistics obviously speak for themselves and are impactful, I think it's really important to understand that this is also really important for the quality of life of each of our clients. In this chart here to the right, you can see that most of our savings came from Medicaid at 94%. This study was heavily focused on Medicaid savings. Most of our categories fall within that. And then you have the shelter savings as a smaller percentage, although nothing to scoff at because that shelter system is very expensive. But I think it is very telling that most of the savings did come from avoiding things like hospitals, unnecessary hospitalizations and things of that sort, saving Medicaid money. So all of this taken together shows that Project Guardianship's model of guardianship has saved over $160 million for those 236 clients that were on that original roster. And so when you get a copy of the report, it will say that 236 is our population. Obviously, that's not the population of everyone who has a guardian or needs a guardian in New York State, but that is our Project Guardianship's larger population as compared with the 2 samples I described earlier. So for our population, just these 236 clients, we were able to save $160 million over about 9.5 years. So with that information, we were able to extrapolate. And we know that there are over 28,000 people in guardianship across the state, with over half of those being in New York City. So we estimated that nearly $67,000 can be saved per year for each person in guardianship statewide. That is a lot of money. But extrapolating further, we know that New York State could save almost $2 billion in public dollars if every person who needed a guardian had a good guardian. So this last bullet here is about the shelter system savings. And by stabilizing clients and preventing shelter placements, we also saved about between 6.5 and almost $18 million for the shelter system. The reason that this is given in a range is because we used two different measures for how long someone would be in the system. The lower bound is just the average time that anyone spends in the New York City shelter system, which is about 11 days. However, our clients often come to us in crisis. As Nikki mentioned, our cases are often very, very complex. And so we took the average of how many days our clients had either been at risk of homelessness or actually homeless, and used that as the upper bound. So that's why we have a range for that one, and not a range on the other ones. So in conclusion, for the actual statistics, I think they highlight both how much money is saved and also the incredible changes to quality of life for all of our clients, which is really the goal and the heart of Project Guardianship. And to illustrate that, I will now pass the baton over to our experienced case manager, Satasha, to tell you about one of our clients.
Thank you, Tahaya. Good afternoon, everyone. My name is Sutasha Johnson, and I'm a case manager with Project Guardianship. Today, I would like to share a story with you about one of our clients, Miss Dolores. Miss Dolores was born in a small town in Puerto Rico, where she lived until the age of 14. At the age of 14, she migrated to the Bronx, New York, where she migrated, to the Bronx, New York, to take care of her sick sister. While there, she met the love of her life, married, and had several children. Over time, Miss Dolores started to display decline. Her family noticed it, but not wanting to be a burden on her children or her family, like so many in the aging community, she suffered in silence. After several hospitalizations due to falls in the home, Miss Dolores was diagnosed with dementia. After being diagnosed with dementia in August of 2019, Miss Dolores was appointed a guardian. During that time, Project Guardianship managed her case. After her last fall last year, Miss Dolores had an incident where she hit her head in the home and suffered a concussion. She laid there until the next day due to having very limited home care hours. While in the hospital, she stabilized and was transferred to a rehab center in her community. At that rehab center, Miss Dolores had to learn how to walk, talk, and eat again. During that time, I worked with her multidisciplinary team to establish services for her so she can safely be discharged home. One of those very important services was the NHTD program. That is the Nursing Home Transition Divisional Program offered by New York State. That program allows persons in the community to have 24-hour home care services. So once she was approved for said service, she had services that would then support her through care coordination, medical supply services, visiting nurse services, speech therapy, as well as primary care services that would support her in the home. Ms. Dolores was then cleared to return home to her apartment in the community. And after that time, Ms. Dolores's family, myself, and a few others celebrated her 77th birthday this past December in her home. I want to thank you all for joining us today and allowing me to share such a wonderful story about our client, Ms. Dolores. Thank you. Tahaya, back to you.
Thank you, Satasha. So we're wrapping up here now. Implications of our cost-benefit analysis. So Project Guardianship has demonstrated that investment in person-centered guardianship models addresses critical needs for a rapidly aging population while yielding significant public cost savings. This approach highlights the fiscal and ethical imperative for scaling such programs to meet statewide needs. As I mentioned before, New York State could save nearly $2 billion in public dollars each year if every person who needed a guardian had a good guardian. And again, this is specific to our model, which is pretty intensive and interdisciplinary. And this analysis is a critical tool in our advocacy for state funding for a public guardianship program. The SING proposal. New York State does not have a publicly funded guardianship program, and Project Guardianship organized a coalition called Guardianship Access New York. I might refer to that as GANI, that is advocating for public funding for a statewide initiative of nonprofit guardians to provide person-centered guardianship across New York for people who have no family to serve and no money to pay for a private guardian. We propose this statewide initiative to sufficiently fund the nonprofits that have already been doing this work and already been doing it well. We're dedicated to high quality services and expanding those high quality services. As I said, over half of the guardianship cases in the state are in New York City, but that leaves a lot in the other counties as well. And people in the entire state deserve the same access to quality services. Currently, there's not enough funding to meet the need throughout the state. For example, our organization is serving the 5 boroughs of New York City. So that's about 17,000 people who need a guardian, and we only have funding to serve 200. So the need is way, way higher than we have the resources to provide for now, but that's something that we are advocating to change. In our proposal, we are asking for $15 million to serve 1,500 clients. Taking the information that I've presented here today, that would save us about $85 million for the state. We take that $67,000 that comes from savings per person per year in public dollars and multiply that by the 1,500 clients we would serve, and you have $100 million. You subtract what we're asking for from that cost, and you have $85 million saved for the state. To us, it's a no-brainer, and we are currently really advocating for this and building this initiative up. So this is really exciting for us, and I think right now we're going to break for questions, and then we'll wrap up again in about 10 minutes or so.
Good afternoon. My name is Alexandra Bell. I'm the manager of communications at Project Guardianship. I'll be leading the Q&A. We have a number of questions from the participants. For the participants, if we're unable to meet all of the questions, we'll be able to, you can email and we can follow up with you about them. First question, how are you funded?
I can take that one. The Guardianship Services Program is exclusively government funding. We have a close collaboration with the New York State Unified Court System. They're our largest funder, but we also have a little bit of money from the New York State Office for the Aging and a little bit from the New York City Council.
Thank you. How are you paid when the client is indigent?
Thankfully, because of the funding that we do have, we do not need to rely on fees. That's what guardianship fees, that's what allows us to fill that gap for the courts when they can't find private practicing guardians to serve because there is no money. And this is the need that Tahaya was speaking about in terms of we're seeking more public funding to, because as Tahaya said, our funding currently is only enough to have a caseload of 200, which is not, doesn't meet the need of the poor people throughout the state that need guardianship services.
How did you get data on healthcare costs and other factors for a client from before they were with Project Guardianship?
Excellent question. Because we are legal guardians for our clients, we actually, as long as we have medical information access permissions, we can access their medical data from before the guardianship as well. I think that was intended to be able to provide the most comprehensive and well thought out care for our clients. So, you know, they don't just come to us in a vacuum, they've had a history. So we did go through a rigorous IRB process, both with George Mason University and the Bronx Rio, in order to ensure that our orders were up to code, so to speak. And we had all of the proper permission to view our client records within the system.
Thank you. Will the anonymized data be available for researchers and advocates? If so, where?
If you mean the data on our specific clients, no. Similarly to the answer I just gave, we have this data because we are direct guardians for our clients. And actually it was a bit tough to even get through that process. So for obvious reasons, I think it's really important to protect all health information. So the actual data will not be available, but of course, the information in the report will be sent out after. And if you have any other specific questions, you can reach out to me.
Is there data available to show cost savings to judiciary when states shift to increase use of less restrictive alternatives?
Sorry, can you repeat the question, Alex?
Yes. Is there data available to show cost savings to judiciary when states shift to increase use of less restrictive alternatives?
There's not data that I am aware of, but if people are able to stay out of the guardianship completely, that reduces the cost to the judiciary significantly, because a guardianship proceeding requires a lot of interaction with the courts. Not only is there a petition, an investigation, a hearing, several, court employees involved, but if the judge decides that a guardianship is appropriate, then the court is responsible for overseeing that guardianship for its duration, which can be 20, 30 years really. And then also, delaying a guardianship would reduce some of those costs, just because the costs are ongoing as long as the guardianship exists.
Good. Were the savings spread across all your clients in the sample, or was it concentrated among a few?
That's another great question. So I would say a little of both. We had cost savings from all of our clients, because as I said, our clients come to us in crisis. It's very rare that we have a client that has chosen to enter a guardianship arrangement with us. But there are clients who incurred more savings than others by working on their case. So for instance, I mentioned that statistic about the psychiatric hospitalizations, and 3 out of 4 clients had reductions. The sample size for the psychiatric stays was very small. We had about 10 clients or less of that 33 sample actually, that were actually staying in psychiatric hospitals. And of those clients, almost all of them were going in and out of the facility very often. So you can imagine that the cost savings for these few clients was very, very high and concentrated there. But at the same time, sometimes when you don't have people to care for you, or if you have an accident that may be relatively minor, if you live with someone, or if your kids are in the same neighborhood or something like that, you may have to call emergency services. And so you are having a more increased hospital utilization than maybe you would have just by having more community supports. So while we did see savings across the board. There were some areas that had high concentrations, like the psychiatric hospitalizations. A similar cases with the homeless shelter savings. So a lot of our clients come to us either through the hospital petition or a nursing home petition. And so they're already in a facility, they are already technically housed, whether or not they're in their community dwelling. So for the people who actually are homeless or are at high risk of homelessness, it's a much smaller number. But because of the high cost of being in a shelter, they incurred a lot of cost savings, although they were a smaller group than, say, everyone who has visited the hospital over 10 years. So good question, a little bit of both.
Second, sorry. How could programs in other states adopt the PG cost benefit analysis to their own state and model?
I'll take that one again. I think that the main thing to do is to read the report. That's just a little plug. Because the methodology section actually clearly lays out what we did over time. And obviously there are strengths and weaknesses to every study. And so if we can iterate on the report that, Project Guardianship is putting out now, then it can only get better and more specific. And with the accumulated data over states, we have an even better chance of advocating for the funding that we need. The second thing that I would say is to work with the data that is publicly available first, like search high and low for all sorts of data. That's why I really wanted to talk about our partnerships at the beginning, because although it's really important that we have the data for our specific clients and their hospital utilization, there's a ton of data that's put out by the New York City Department of Health all the time. There are tons of reports. There's an open data portal that allows you to see different data by race, by neighborhood, by economic status. There are some really powerful tools out there that are completely free. I saw that there were a lot of nonprofit people in here today. So anything that's free is good for us, right? So I would definitely use all of the available resources that you have for free and check all state and city resources, as well as asking researchers and people whose name you might see pop up a lot as you're searching. Generally, people are happy to talk, happy to give a little bit of direction and expertise as you go along. So don't be afraid to ask questions, really check out the methodology section and use what's available to your advantage.
Thank you. In efforts for guardianship reform, do you see significant pushback from the private bar and private professional guardians?
Project Guardian, not pushback in terms of funding for nonprofits to do this work. We have seen efforts for the private bar for their rates to be increased so that they can continue to do the work. Project Guardianship feels that it solving the lack of guardians across New York State shouldn't be a one size fits all, and that there are, first and foremost, if a family member or friend is available to serve, we want that. And we certainly want the private bar to be able to continue to serve as guardian and to be paid fairly. We're looking specifically to fill the gap when those two resources aren't in play.
Thank you. How are lawyers retained and paid? Per case, per hour? What role does mental hygiene legal services play?
Our lawyers are on staff salaried PG employees, so we're not needing to retain counsel. Typically, there is an attorney assigned to every single PG client. So there are occasions when, for a certain case, if there's something specific that we do need outside counsel for, it's possible we might retain outside counsel. Sometimes we have relationships with firms that will provide pro bono services for our clients. So, but generally, when we talk about the legal services that are provided to our clients, those are provided in-house. And the mental hygiene legal service is not, there isn't a relationship, I would say, per se, but many of our clients in the guardianship court were represented by mental hygiene legal service attorneys. So they will often maintain that relationship for the duration. So if anything else does come up in the guardianship court, they will be reappointed to represent the guardianship client separately from the legal services that PG provides in-house.
Are you allowed to keep wards if they are in a facility or only in the community? Also, is there a waiting list currently for Project Guardianship to accept new cases?
Yes, we absolutely keep wards or clients rather who are in a facility. That is something I know many community guardianship clients through, for guardians appointed through New York City Adult Protective Services, that is a difference in that they are not contracted to cover institutionalized clients, but we don't have that restriction. And yes, we continue to visit our clients monthly and provide the full range of services for clients who are in nursing homes and rehab centers, variety of housing types. What was the second part of the question, Alex?
Is there a wait list for Project Guardianship to get more clients?
There's not a wait list. We do have, to maintain our staffing ratios, we do have that maximum caseload. At this time, we are not at our exact maximum, so we are accepting new cases, but it's not, it's something where we consider new cases as they come to us. So the court will reach out and say, we have this case that is complex and we would like to appoint you as guardian, and we'll take a look at it and see if it seems that it's something that we can adequately provide, a full range of services and the services that the client would need. And if so, we'll go ahead and tell the court that we'll accept the appointment. And, it will look at what borough it's in also, and just make sure that we are spread adequate staffing throughout the city and the neighborhoods that we have clients in currently. And we want to make sure that we have the ability to fully serve the client before accepting the appointment.
Yeah. Can you say more about the SDM model you use to avoid guardianship and efforts with LRAs before accepting nomination to serve as guardian?
The supported decision-making model, we're just in sort of a pre-pilot testing phase. So we're not utilizing it yet. What we're doing is in New York, there is a model being implemented by an organization called Supported Decision Making New York, that is tried and true and tested. It's specific for people with intellectual and developmental disabilities. We recognize that older adults who have been making decisions their entire lives and then have an event or something that they're losing capacity and are losing their ability to make decisions. It's a very different process and outlook that's needed for that population. So they're not equal, the two different populations. So we're working with partners who were involved in the formation of the model for the IDD population to see what lessons we can learn from the process that they followed, to develop a different model for older adults, because we just know the conversations are going to be very different about how you want to make decisions for living for whether, you know, the 20 or 30 years that you might be living as you're aging with diminishing capacity. So we're in very early stages of that. Unfortunately, in our guardianship program area, we don't learn about the guardianship proceeding until after a judge has already determined that a guardian is needed. The judge comes to us at the point when they're asking us if we can take on this particular guardianship case. So we're not able to work at that point on less restrictive alternatives, but what we can do with each of our guardianship cases is we can see if, as guardian, there's things we can do to stabilize them and then petition to terminate the guardianship. Or if we find that they already are stable and we don't think the guardianship is needed, we can go back to the court and make that argument to restore the rights of the person. These other two, you know, programs are the supported decision making and the agency power of attorney are very early in their development. I will say also, though, like I mentioned earlier in the beginning, we have been working with the unified court system to increase resources on less restrictive alternatives, and our helpline. It's intended for people to call with questions. It prior to a guardianship or after a guardianship has been put in place, but prior to the guardianship, the purpose of those calls is we always ask enough questions to make sure that all less restrictive alternatives have been exhausted. Because sometimes, you know, too quickly people will say guardianship is the right answer. Guardianship is how you're going to solve this problem. And that might not be true. The person that they're getting their information from might not know about things like supplemental needs trust, or, you know, how you work with your bank to get, you know, people on bank accounts and all the other public programs and services that might be able to avoid guardianship. So I'd say, you know, if a guardianship is not in place, call the helpline. And even if it is in place and you're thinking about avenues to termination, call our helpline.
Great, thank you for that thoughtful answer. We are running a little short on time. We have so many thoughtful questions come through. I'm going to ping it over to our Chief Advancement Officer, Brianna McKinney, so she can offer some final words.
Thanks, Alex. Thanks for leading the Q&A. And thank you to my colleagues, our panelists, Tahaya, Satasha, Kimberly, and Nikki. Let me just share my screen here quickly. Okay, great. And thank you to all of you for attending and participating in today's webinar. As was mentioned earlier in the presentation, we've been working on this study for several years, and we're really just thrilled to be here to be able to share our process and findings with you all today. If you want to stay involved with us, Project Guardianship, or with this body of work specifically, there are a few steps that you can take on your screen right now. First, you can sign up for our quarterly newsletter, e-newsletter, I should say. You'll get regular updates about our work at PG, but also about issues unfolding in the adult guardianship space more broadly across New York, across the country. Alex will drop that link to subscribe into the chat. Second, if you want to learn more about the study itself or the implications, please do reach out directly to Tahaya or to Kimberly, and we'll be dropping their emails in the chat as well. As Kimberly mentioned at the beginning of the webinar, you will receive the full report in your inbox in the next 5 to 10 minutes or so. So please keep an eye out for that, and feel free to share it, of course, with your networks. And then lastly, if you're interested in joining our advocacy efforts, Tahaya spoke a bit about our work to establish a statewide initiative of nonprofit guardians. And this really is focused on addressing the shortage of qualified guardians in counties across the state. You can follow us on social media, visit our website for more ways to get involved. And you can also send us an email directly to advocacy@projectguardianship.org. If you want to discuss this work in greater detail. So again, thank you for being here this afternoon. We're at 3:01, and have a great rest of your day.